Greetings to you and yours, and a warm welcome to the Government Information Center. We bring you latest and exciting topics. My name is Petrus Ichpamteya. I'm your host today. And our topic today is Namibians' preparedness and response to monkeypox. And to break it for us today is Dr. Andreas Shininga Vamwe, Chief Medical Scientist at Molecular Diagnostic Unit at Namibia Institute of Pathology. And also Ms. Rachel Kuma, Associate Director at Health Policy and Communication in the Ministry of Health and Social Services. Good afternoon, Dr. Andreas and Ms. Kuma.
Good afternoon.
Thank you so much for joining us. Monkeypox is an infectious viral disease that can occur in humans and in some animals. Symptoms include fever, swollen lymph nodes, and rash that forms blisters and then crust over. The time from exposure to onset of symptoms ranges from 5 to 21 days. The duration of symptoms is typically 2 to 4 weeks. There may be mild symptoms, but it may occur without any symptoms being known. The classic presentation of fever and muscular pains, followed by swollen glands with lesions all at the same stage, has not been found to be common to all outbreaks. Cases may be severe, especially in children, pregnant women, or people with suppressed immune system. An ongoing outbreak of the viral disease monkeypox was confirmed in May 2022, beginning with a cluster of cases found in the United Kingdom. The first confirmed case was traced to an individual with travel links to Nigeria, where the disease is endemic, and was detected on 6th of May 2022, although it has been suggested that cases were already spreading in the previous months from 18 May onwards. Cases were reported from an increasing number of countries and regions, predominantly in Europe, but also in North and South America, Asia, Africa, and Australia. As of the 20 July, there have been a total of 14,547 confirmed cases. As of 27 June, the World Health Organization has declared this an evolving health threat rather than a public health emergency of international concern. And to bring it for us today, I would love to start with Ms. Rachel. What is monkeypox and possible causes of monkeypox?
Thank you for that question. And just before we start, you introduced me so nicely, but just to make sure there's no miscommunication, I'm from the US Centers for Disease Control and Prevention. I know the Ministry of Health weren't able to be here today. We work very closely with them. So thank you for the introduction and thank you for the question. So what is monkeypox? It's a virus. And it's a virus that is caused, and it's very similar. It's from a family of different illnesses, and one of them in that family is smallpox. So that's one that we perhaps might have heard of a bit more. It's been around. We know about the history there. But it's much milder than smallpox. And I think another thing that's really good to know is that it's rarely fatal. And also just keeping it simple, but it's not chickenpox. You know, sometimes we end up having, there's a lot of words now, monkeypox, smallpox, but it's a virus. And the other thing, just remember, we've lived through 2 years of a pandemic. It's different to COVID-19. We have, and then you introduced that as well so nicely, saying that it's an evolving health threat, but it's not a public health emergency right now, and probably won't be. So it's a virus, it can make people ill, and it's in the family of the smallpox virus.
All right, thank you so much, Ms. Rachel. Mr. Andreas, what is the origin of this outbreak, and have we recorded monkeypox cases in Namibia?
Thank you very much to the question, and I'd like to say good afternoon to the viewers and the listeners. Since May 2022, we have been a lot of sporadic cases which have been recorded in Europe and also spread out to United States of America, Canada, and Australia. And this the first case of monkeypox which was detected in UK it was linked to a traveler who traveled to Nigeria. And also recently, we have also 3 cases which were reported in South Africa, where we have two gentlemen who have never have any history of traveling, and one of the case came from a tourist. However, when it was the genome, when it was sequenced and characterized, it was found that all these cases, they cluster very well with a West Africa clade. Since we know that in West Africa we have 2 clades, West Africa clades, which is composed of part of Nigeria, Sierra Leone, Cameroon, and we also have Central Africa, which is central more with Democratic Republic of Congo and part of South Sudan. Those are the 2 clades which we have, and these cases were found to cluster very well with West Africa clade. However, the question here is, the origin is very difficult to tell, since there are some of the cases where never have any history of traveling. Those ones which you have linked to history of traveling or to be in a part of endemic area is understandable. But those ones who have never traveled to any of the endemic area, that one is very difficult to tell the origin. Thank you.
Ms. Rachel, how worried should we be about this outbreak, and what is the risk of wider transmission in Namibia should we record any case?
I think the message is there's no need to panic. Yes. It is something that can be passed from person to person, but it gets passed often through direct contact, and touching of a lesion. So I think really the idea is, if you don't know someone who has monkeypox, then you're very unlikely to be at risk. So it's certainly not something that we need to be worrying about going into the workplace or going into school. But at the same time, if someone does have a rash, isolation is very important. Things do spread, and we've seen that now around the world. You were giving the figures at the start that clearly there has been breaks multiple times in, when you know that you have something, and isolating. But overall, I think there's no need to panic. But what's really great is that we're talking about it, being informed, knowing. And I think most people, when they do get a rash, go and get it checked out. And that's, the very simple advice. If you feel there's something wrong, go get checked out with your doctor.
Ms. Rachel, again, since we had COVID-19 outbreak, it's bring a shock to the citizen. Maybe people will feel like, if I see someone having rashes, I'll be like scared. Maybe can you tell us if we have encountered any monkeypox in our country from our visitors that are coming to Namibia?
No, Namibia hasn't detected any cases. And they are, the testing capacity is here, and I'll defer to the expert here to talk more about that. But no cases have been reported in Namibia, but the country is ready to respond if there is one.
All right. Ms. Andreas, what are the signs and symptoms of monkeypox, and how is the virus transmitted?
Thank you very much for the question. And probably to go back to the previous question, which you were asking about if we have any suspect case in Namibia. Yes, we received 2 suspect cases, and we test them, and they test negative. That's very good news for Namibia. And to come back for the symptoms involve fever, rashes, headache, swelling of the lymph nodes, back pain, muscle ache, lack of energy. Those are some of the symptoms that you can get. And the transmission usually happens through the direct contact of the body fluids, direct contact with the contaminated materials, for instance, beddings and clothes, and also respiratory droplets, when people really talk in direct contact, especially for a very long time. And this virus can also be transmitted from the mother to the unborn child, since it can cross the placenta. And there are some cases also where the sexual contacts, they also are another route for this transmission of the virus.
While we are there, you mentioned about it can spread from maybe when I'm talking to a person. Probably if the outbreak comes in Namibia, will we be required to go back to the mandate masks?
Yes, the answer is yes, especially if you know that, for instance, the health workers,
Yes.
they get more direct in contact with the patients. In that case, they really need to put on their mask. And although those people are taking care of the sick people, they also need to take care of, to put the mask so that frequently they have a contact frequently, so they need to put on their mask.
A lot of people will be like, oh, no, the government is just telling us not to fear, but do we have testing facility in the country that can really tell that yes, and confirm that we don't have any case in the country?
Yes, as I have mentioned that we have received 2 suspected cases in Namibia. We have set up testing capacity in Namibia at Namibia Institute of Pathology, and we are applying polymerase chain reaction, the PCR, the same technology we test for COVID. However, different targets which we are amplifying. And we also have developed sample collection guidelines that are available to all the health facilities. And the packaging and collection and the transport, they are handled in the same way as we have been handling COVID. It means COVID in this case has really taught us a lesson, so which we can also apply in any situation.
You mentioned something about it can be transmitted via sexual contact. Maybe could you elaborate which type of sexual contact? Because I read something and find an information that it can also spread via an anal sex where we have maybe a man and man sleeping together.
Yes, this one I just based on, there are some studies which are available where they have seen the majority or some of the cases. There were men having sex with other men. That's where they have picked up a lot of cases rather than from the heterosexual contact. And another thing is some of these blisters or the rashes, they also find on the genital parts of the individuals. And that's why they, whenever they get in contact, then can be infected.
Right. Miss Rachel, what part of the body does monkeypox affect? How severe can the disease be? And does monkeypox leave scars?
Great question, and that follows directly on. So the spots can be on any parts of the body, but they're more often found on the extremities, so perhaps the face, the hands, sometimes even the inside of the mouth, though, and then I start saying, but also on the chest, and like we said, on the genitals or the anus. So basically, it can be anywhere, and what that means, and that's sometimes how it gets passed, because if someone is perhaps ignoring the rash, perhaps if it's on the genital area, and then if there is some contact, that is how the virus passes from one person to another person. So that's why we're seeing, because when you have the spots or the pimples, and they have different stages, until they've gone, that person is actually infectious. So that's one of the challenges. I think all of us, when we're sick with any disease, want to get better as quickly as possible, and particularly after COVID, where a lot of us feel like we've been stuck at home for various reasons, whether you've had to be in quarantine or whether you've had to isolate. I think the world is very eager to get back to living. And that's perhaps one of the challenges that we're seeing, that people don't want to remain at home. And when you look at a disease like this, you actually would need to isolate. It can be for, maybe 2 weeks or longer. So what I really, just to go back to your question, the spots go on the bodies, mostly perhaps on the extremities, the hands, the face, but also the chest, the genitals. It can be severe. Again, different people, perhaps children can have more serious, people who are immunocompromised. And the scars, you can have lasting scars, not necessarily always, not all of the scars, but there can be some scarring.
Do we have treatments of those scars, maybe if like rashes?
There's no specific treatment for monkeypox itself, but there are antivirals, and some of the treatment is symptomatic. So we talked about some of those symptoms being perhaps like a fever. So you might just take fever medication, something that might lower your fever, something very simple. But so, and you know, sometimes if the skin is sore, you know, people might put a cream on. So there are various options, but obviously the best, as always, is to speak to your doctor to get that specific advice for what you need.
Okay. Dr. Andreas, when is the monkeypox infected a person no longer contagious, and does the virus mutate?
Yes, thank you for the question. The person is out of danger of transmitting all the virus whenever all those rashes or the blisters or the lesions have completely healed. So the person has to be really in isolation until all those lesions they have completely healed. And to couple to that part of the question, you ask if the virus can mutate. Here, I want to bring this up also to the point that this is a DNA genome-based virus, and most of the genome-based viruses, they don't mutate that quickly, but they also mutate, but at a very lower rate, not in comparison with the RNA-based genome viruses. So, however, in this case, there are some studies which were documented in Portugal in this current outbreak, where they have isolated some of the cases, where they found that when they compare them with the previous year's isolates, they found some of the single nucleotide polymorphism, so those are change in single nucleotides. And also among the cases themselves, which are currently just isolated also in Portugal, they found that there was some diversity among those isolates. Yes, in this case, the virus can mutate, but there's no need to panic in this case because it's a DNA-based virus which doesn't mutate that fast.
Okay. There has been no death reported about monkeypox. It's indicated that the virus can lead to other problems, complications, like pneumonia and infections in your brain or eyes, which can be fatal. Are there any other complications that could arise from the virus?
Yes, as you mentioned, those viruses. That's why, for instance, especially in the kids,
yes,
they can really lead to death. So in this case, really, there are some documented complications which have been observed. For instance, also from the immunocompromised individuals. Also, they have seen some of the complications have been also recorded.
Mm-hmm. Ms. Rachel, how can I protect others and myself against monkeypox?
I think the first tip is always to know about the disease, and that's what we're talking about today. What are the signs and the symptoms? So if you've got a rash, get it checked out. If you have a fever as well, stay at home. I think that's advice that has lasted from COVID. It's telling us that if you're not feeling well, don't spread it, don't pass it on. I think that's something that we've all learned. And again, as I was saying now, we all want to go back to living. And when we're starting to get sick and passing it on, it means we have to stop again. So very simply, if you're sick, go see a doctor, isolate, stay home. And then again, knowing those signs and symptoms so that if you know a friend or someone who has a rash, you can again pass that information on and say, hey, I think that's something that needs to get checked out. But going back to our beginning discussion, this is pretty rare, so it's not something we need to panic about. And I think it's great to be prepared, and there are medical treatments and options there if you do feel worried and you would need treatment if you did get monkeypox.
In terms of, since the school has started, where kids are gathered in a group and one may be detected with the symptoms of monkeypox, what are the procedures they maybe to follow up and also give the treatments to others or check others?
Well, I think, again, leading on from saying what we've learned from COVID, what we've seen is those procedures and the communication and passing it on. And so what you'd see very practically is if if someone is diagnosed, you would then share that information very much in the same way that, as in schools now, if someone has pink eye or, you know, some kind of other, the scabies, that's a great example. I know we had the scabies, that's been a challenge in this country this year as well. And so you pass the information on, you tell other people, and you just make sure that that group is aware of the information and knows what to do.
Right, at the hour mark, we'll be opening our lines so you viewers can also engage with us and also hear from our panelists or ask any questions that you have. Our telephone is 061 400 397. You can also follow us on our MICT page on YouTube, MICT Namibia on YouTube, or Ministry of Information and Communication Technology, Republic of Namibia. Coming back to Ms. Rachel, as you said, if I detect some symptoms, I have to isolate or stay at home. Does maybe there places or certain area that set up by governments to put people that will be tested positive of this virus or maybe has symptoms of that virus?
Again, it brings us back to all the gains that we've made from COVID. And it's really lovely to have a chance to actually reflect on some of the positives. The country now has more isolation facilities. And, you know, I'm able to refer to the recent briefing from the President and the Minister of Health, where they were able to quantify and give all those great strides that the country has made. So the country now does have more resources than ever before of what could happen. And so if you're not able to isolate safely at home, and that is a very real concern, perhaps if you're in a busy household and perhaps there's someone who's vulnerable in your household, and you would want to say, you know, I need support, that support can certainly be addressed. And because, as always, it's about communication, it's about explaining your situation and allowing the options to be discussed to see where you could go from there.
Mm-hmm. Mr. Andreas, Dr. Andreas, sorry. Other endemic contagious diseases have vaccines. In this case with monkeypox, if so, who is eligible and where can one obtain the vaccine?
For this for this virus, at the moment in Namibia, we don't have a vaccine for monkeypox. But it has been shown before the elimination of the smallpox that there's a cross-reactivity between the smallpox and the monkeypox, since they are in the same family and their genomes and they are very the same. It means there's if you can vaccinate with the smallpox virus, that will be able to eliminate the monkeypox. But at the moment, we don't have any vaccine in Namibia. But however, there are some countries which were producing those vaccines, and they are still having those stocks of smallpox vaccine. So in the discussions, they're in progress, where the manufacturers of those vaccines, they can be requested if they can revive some of those vaccines so that they can be used. That it has been proven that 85% there's a cross-protective with the smallpox vaccine.
Just maybe to make it clear, because I heard some rumors, I don't know if it's rumors or it's true, that monkeypox can spread or it's detected in people who are fully vaccinated of COVID-19. Is that true, maybe?
That's a very difficult rumor to rumor on.
Yeah.
Actually, it's very difficult to get a cross. I mean, to detect smallpox virus or monkeypox virus in the person who has been vaccinated with a COVID vaccine. Since these two viruses, they are completely different from each other. There's no way you can mix one with the other. So that one, it's really, I challenge any person who can come up with that and show me that.
All right.
But anyways, it should remain as a rumor.
All right, it will remain as a rumor. We are aware that some domestic animals can be affected by contagious disease that affect human beings. We would like to find out if this is the case with monkeypox, Ms. Rachel.
So animals. So in things like rats and mice and squirrels, we don't yet know all the animals that can be affected, but the biggest, broadest answer would be to say that it's quite possible that monkeypox could be found in all mammals. But as always, perhaps bring that perspective of don't panic. A good example is in 2003 in America, there was an outbreak, just a handful of cases, 47 cases, but it had started, they found some animals had been brought into the country, it had then passed to pet prairie dogs, but it didn't pass any further. So that's, perhaps, we look back in history sometimes to see and to learn. So while there are examples that it could, it's not something that you need to go home and start worrying about your dogs or your cats. But again, if you were isolating at home with monkeypox, you might also just follow precautions and perhaps be just a little bit careful.
What animals can carry monkeypox, and what are possible treatments?
Also to me? Yes. Yeah. So really a wide range of animals. So it could be monkeys, anteaters, hedgehogs. I mentioned the prairie dogs, squirrels, shrews, rats, mice. So it is a wide range. And then in terms of treatment, I'm really going to refer that would be to your veterinarian. They would address that and make an appropriate course of action if it so happened to be a domestic situation.
Mr. Andreas, monkeypox was first discovered in 1958 in Denmark, when 2 outbreaks of a pox-like disease occurred in colonies of monkeys kept for research, hence the name monkeypox. Now, in terms of our tourists and visitors that are coming also to visit, are there maybe procedures that put in place also to protect them from animals?
Yes, as excuse me, as we know that we are aware of the mode of transmission, or the possible mode of transmission of viruses. So the tourists really they can be just create awareness among themselves that the virus, even though we are not in the endemic area, the virus can be transmitted also from animals. And up to this point, nothing has been proven yet what is the reservoir or the host animal which can carry, or which is regarded as a carrier for this virus. So we have to be very careful whenever we are dealing with animals.
All right. We have our first caller for the afternoon, that is Peter from Benue. Very good afternoon to you.
Hello.
Hi. Hi, Peter.
Hello. My question is, hello?
Yes, go ahead.
My question is, how contagious is this virus in comparison to other outbreaks we have had, in the history of, virus and all that? How contagious is it?
All right. Thank you so much, Peter, for your question.
Okay.
All right. Ms. Rachel, maybe you can answer that question, please.
Okay. I'm going to give a couple of examples. And like I started, it's less contagious than COVID-19. It is less contagious than measles. And it is something that requires, when we've been talking about how does it spread, you're most likely, if you were to get monkeypox, would be having direct contact with someone else who has monkeypox. So, touching, like, I was sort of demonstrating, touching and, close contact, being together, holding hands, that type of thing. In terms of, we talked about the respiratory secretions. That sounds like a very fancy way of speaking, doesn't it? Just the air, and breathing it. But you'd need to be close together. We're not saying that if you're in the shop, as you're passing by and passing through, that you are likely to catch monkeypox. And again, with the animals, it's not, as my colleague said, it's not endemic here. So when I was saying it could be in a whole range of animals, just because those animals are in Namibia, it doesn't mean that monkeypox is in Namibia. So really, it is much less contagious than even smallpox, which obviously it's wonderful that smallpox has been eradicated. So it's, I think on the worry list, it's your worry could be it can be milder, and other diseases that we're a bit more familiar with, like measles, are more contagious.
In terms of somebody had or maybe detected with monkeypox and passed on, in us, Vambu, we have that thing of, no, this person had fancy clothes, had fancy things, I have to take them and keep them. Is it maybe possible that I should take them and maybe wash them and continue wearing them, or should we ban them?
I think in that very specific situation, you would get the very specific advice. But we do know that sharing the bedding or the clothing of the person at the time. So I don't want to speak to the entire possessions of someone, but so you could have a risk through your clothing items, which is why if you're a healthcare provider or a family member with someone who had monkeypox, you would get very detailed information about how to prevent the spread of infection. And my colleague here again, we were talking about masks earlier. So for example, people in the lab who are testing for monkeypox will be very careful. If you are isolating, and you asked the question, is there somewhere to go if you needed to? So we always want to be careful about passing infection across.
Mr. Andreas, the Namibian Institute of Pathology mostly deals with testing and also giving out the results. Now, in terms of schools, since also at the outbreak of COVID-19, where we were struggling with testing kits and all those other things, is the NIP ready and have fully equipments to deal or to combat this outbreak?
Yes, I would say yes. And initially, when the monkey test started with some other countries, they were using in-house test assays, which were developed in-house. But currently, there are some companies which are developing commercial available kits, the kits which are ready-made. And for NIP, that's some of the kits which we are acquiring. And also, as we mentioned, that COVID has really taught us a lot of lessons. Those instruments also which we're using for testing COVID, they are also the same instruments we would be using, only different kits.
Okay.
So we are fully equipped.
All right. Also, viewers, you can also share your questions via our social media, then we can read it. We have our question here from Richard Kambida says, what if our neighboring countries have an outbreak of this pox virus? Shall the border-lying area of Namibia not turn into the soft underbelly for monkeypox to penetrate, as happened with males and scabies, miceless and scabies? Ms. Rachel?
It is a great question. But I think one way to think about that is, first of all, look globally. That we're seeing many cases in many countries, but we're not seeing shutting of borders. I think one thing we've learned from COVID is the devastation that can cause. So we need to be very careful. And I know a lot of the global calls were about being very careful about what that does when you start to change your border requirements or entries and restrictions, and it can be very challenging for economies when that happens. But at the same time, having those protections at the border is very important, and I think again we can celebrate just how far Namibia has come and the measures that are put in place at the border, the options to have health checks, whether it's the temperature testing, whether it's screening forms, and certainly the world is on alert. We can get daily numbers of the number of cases. So if, for example, we saw a rapid increase in the bordering countries of Namibia, then Namibia would be able to make some different plans. But right now, I think you can travel without being unduly worried or concerned. I think we can still continue to move across borders.
But since we have cases that were reported in South Africa, probably maybe if people are moving from South Africa to Namibia, or I move from Namibia to South Africa and come back, are there maybe testings that need to be done before I leave the border?
We have to also think about practically the cost of testing, the feasibility, the timing, and prioritizing testing resources for where it's most needed. So really you want to test someone with symptoms rather than every single person. And I think the other thing to remember is that monkeypox has been around for a long time. And many cases will be going undetected, but have been going undetected for years, even though that we're now reporting the cases in South Africa or the cases in the UK or the cases in America or Australia. They've been there before as well. So again, putting in, it's always about a perspective and a balance about what we can do for, and I think we've used this phrase during COVID, lives and livelihoods. What can we do in terms of making sure we keep people safe and healthy, but what can we also do to make sure that our economy is operational? And I know for many people, when it becomes an individual cost of testing, that becomes a challenge. And I know we're all talking these days about the cost of petrol. We're talking about the cost of food. And so we need to think about what is the most practical way for us to keep a country healthy.
Dr. Andreas, a lot of people were so devastated and cannot continue live in a life to come as the life past of COVID-19, though COVID is not yet over. People were so devastated being in lockdowns and maybe in isolation. You will be taken away from your family and stay in an isolated place for 2 weeks. Maybe how long, if somebody detects this monkeypox, how long that person will be needed to be in isolation center?
As I have mentioned before, that the person should be come out of the isolation whenever those scars or the lesions, when they are totally, completely healed. That one it depends on the individuals. Okay. That can take between 2 to 4 weeks, a person to be really completely healed and all the upper skin peeled off and the virus has shed off to be completely. So we are looking in the range of between 2 to 4 weeks. Just depend on the individual's immune system.
All right. Viewers, please share your questions also with us on social media. We have a question from Angel Lad. What is the difference between chicken pox and monkeypox? Ms. Rachel, please.
Well, they are caused by 2 different viruses, which is the first one. So I'll be able to hand over just now in terms of testing. You know, if you test for it, you'll be looking for that very different condition. The presentation of the spots will be different. And again, it becomes a little bit difficult when we're talking to explain it, but your healthcare provider will know. So there are about 6, with monkeypox, there are about 6 stages of how the pox, the spot, develops. And so they look different, and so you'll know the difference. But it's actually a really great question, because I want to add to it. What's the difference between measles and chickenpox and monkeypox? And right now we know that there have been measles cases in the country, and that's actually the question we need to be thinking about. You know, if I see a rash, I don't necessarily want to say, is it monkeypox? I want to say, is it measles? Because I know that there are measles cases in the country. And so as an individual, it can be a little bit difficult to know, you know, what is this rash? And sometimes you get rashes for all sorts of reasons. You sometimes even get a rash that's related to fever. I remember taking my son once to the emergency department because he had a rash, and I was so worried. And it was actually related to his fever, and I was, you know, immediately calmed down. But the example, the reason I'm saying that is because I'm advocating health seeking. Just get help. So if you see a rash and you're not sure what it is, go get it checked out and be reassured, and your healthcare provider will have the information they need. Maybe they will refer for some testing, but just, you know, if you're concerned, get it checked out, and then you can get the help that you need.
Dr. Andreas, in terms of treatments, especially the vaccines, a lot of people, especially youth, didn't take COVID-19 vaccines in reasoning that it came fast, it was a fast thing, and something like that. Maybe in this monkeypox outbreak, since we had it way back, are the countries already preparing for treatments, especially vaccines?
Yes, you're right that people were thinking that this vaccine for COVID has come so fast. The reason for that, the COVID vaccine has come so fast, because the technology has changed. Not in the 60s and the 50s when the smallpox vaccine was developed. So the technology by then was a bit slow, and people, they didn't really understand most of the techniques. But nowadays, every technique is already on tip of the fingers. So in this case, we have seen and also have proven in the past that this vaccine, the smallpox, to eliminate the smallpox, which was declared in 1980, could see really it was really well prepared, and it was quite effective. And it has been also shown that it really covers, as you can see, the wide range of the viruses, where it covers smallpox and monkeypox. So really, the duration of time of generating the vaccine, I don't think is an issue. So really, it shouldn't really scare people to take the vaccine for smallpox whenever it's revived again, because it's the smallpox which has been taken already in the past in order to eliminate the smallpox in the past.
Okay, in terms of also treatments, in time of COVID-19, we had crashes between the Ministry of Health and Social Services and the community, where people are taking elephant dung to treat themselves. Now, in terms of monkeypox, maybe we have something that I can use if suddenly I realize that I have symptoms of this virus? Do there anything maybe I can go and buy in pharmacy just to treat myself?
Really, at this point, I really don't know. So I really don't know if there's anything which, what's happening with the monkeypox is a really symptomatic management. So as far as the symptoms, they can be managed. That's the most important thing.
All right. Okay, Ms. Rachel, because we are a bit running out of time, maybe what message do you have, especially to parents that send their kids to school, not to panic, because this is the time where parents also panic that, oh, my child is at the hostel, where maybe there are kids that also went there with symptoms of this monkeypox. What message do you have to them?
I think it really is, don't panic. I think the risk is low. I think that being informed is very important. And if you need to get checked, and your question there was about, could you go to the pharmacy? I would say, if you're concerned, go to your doctor, and your doctor will help you, and your doctor will be able to give you examples and advice. It's a mild disease if you do get it, so definitely, it's like I say, it's really not something to. We don't want to cause panic. I think it's been a fascinating discussion, but really that message is that just be informed, be aware, and make sure you make use of the health system that we have here.
Dr. Andreas, also maybe your message that you have to the nation, especially in terms of testing. Some people, in terms of COVID, I can detect myself that I have symptoms of COVID, but I'm scared to go for testing because I don't want to go in isolation. What message maybe do you have for this?
Yes. Isolation really is not like a death penalty. So if you have to be in isolation, it's for the safety, it's protection for the others, for your loved ones, and even for yourselves. So if you are being told to be in isolation, please be in isolation and follow all the protocols which are being set up. Don't come out of isolation before the time. And also, if you some suspected cases which are moving around, people are not paying attention or not adhering to the protocols which are being set up, please alert the health workers which are closer to you.
Okay. We have a question from our social media page. Maybe we can answer that before we leave. The question is from Richard Kambida. Can cats carry monkeypox? Yes, Rachel, please.
So we don't know the full list of animals, but it's certainly possible. And so really the advice that we're seeing is to assume that all mammals or any mammal can have monkeypox. But the reassuring line is that we don't have monkeypox in the country at the moment that we've detected. So there's no need at the moment to have any concerns about your cats or anyone's cats. I've got cats, I'm not concerned. No need to be concerned about cats carrying monkeypox.
Yes, Mr. Dr. Andreas?
Yes, as I have mentioned that up to now we don't know the natural host for this virus. If a cat is getting a virus, we really don't know. It's just as we don't know which one is the natural host for this monkey virus. Even though it was found in the monkey is not really the natural host for it.
That question came, and maybe you will see people killing their cats because they are so scared of monkeypox. All right, thank you so much, so much. Dr. Andreas Shininga Vamwe and Ms. Rachel Kuma for coming through and also speak to the nations regarding this monkeypox outbreak.
Thank you.
Thank you very much.
All right, viewers, we come to the end of our session today. Thank you so much for watching. Please do take care of yourself and your loved one, and please don't panic. It's just the beginning of this, but take care of yourself and your loved one. From myself, Petrus, I'm Tinya, the entire crew. Until next time, goodbye.